Hello again, everyone, and welcome to today's episode of Resilient Health Radio. I'm your host, Dr. Darin Ingels, and my guest today is my friend and colleague, Dr. Micah Yu. Dr. Yu is an integrative rheumatologist who practices in Orange County, California, so just down the road from me. And he is board certified in rheumatology, in internal medicine, in functional medicine, in lifestyle medicine. Dude, you got a lot of degrees, a lot of certifications. But I really appreciate Dr. Yu because he and his wife, Dr. Melissa Mandala, who's been a guest previously on our podcast, they practice together. And again, they're really both very good at helping people, again, identify these core underlying root causes of illness. And of course, as a rheumatologist, you have the neat perspective of seeing people with, very serious, complex autoimmune disease. So, Dr. Yu, welcome to the show today.
Yeah, thank you so much for having me. I know we've been trying to get together for the past couple months, so I'm so excited to finally speak with you on your podcast.
As a rheumatologist, I'm sure, going through all of your training and, prior to kind of jumping into the functional medicine field, I'm sure you saw a lot of this. But, when people get a diagnosis of different autoimmune diseases like lupus and rheumatoid arthritis, it seems like the tools in the conventional rheumatology toolbox are fairly limited. It's steroids, it's biological medicines, and it seems to me there's very little interest in the conventional medical world about looking at these root causes of autoimmune disease. And I know this is a 3-day webinar we could really do on autoimmune disease, but what are some of the things that you're seeing in your practice that seem to be some of these root causes of autoimmune disease that maybe people aren't generally thinking about?
You're absolutely correct, Darren. It is fairly limited what a rheumatologist can do. The steroids and the biologics are the main medications. I mean, they work. However, it does the what's the goal and goal of being on these medications? The rheumatologist usually keeps the patients on forever on these medications. And as a patient myself, I don't want to be on these medications forever. So looking at the root causes will give you a chance to potentially come off medications or minimize the medication uses in rheumatology with autoimmune diseases. So what are the root causes of these autoimmune diseases? So number one is you can look at diet and the gut microbiome. So, and a lot of people are eating a standard American diet with anti-inflammatory diet. So that can be a root cause. So we can go through the lifestyle factors first and then move on to the more integrative functional factors. And number two is a lot of people have stress that can cause flares, can trigger autoimmunity, it can raise inflammation, but also people do have trauma that can be a root cause of their autoimmune disease, whether that's emotional abuse, physical abuse, or even a car accident, or even witnessing death. That can be trauma. Number three is exercise and sleep. Those are other root causes. If you are not exercising, that can lead to more inflammation. If you are not sleeping enough, that can lead to more inflammation. Or if you're working night shifts, your circadian rhythm is off, that can also lead to more inflammation. And also, having community is really important too. Having friends and family, because if you don't have a community, you're more at risk of having depression. Or you're having depression, there's a gut brain connection here with the immune system, and that can lead to inflammation as well. So those are some of the lifestyle factors that can influence autoimmune disease. Let's look at the other naturopathic or functional root causes, which would be chronic infections. We know that Mycoplasma pneumoniae, Proteus, also Klebsiella, these chronic low-level infections can trigger autoimmune diseases. Lyme disease, Bartonella, Babesia can also trigger autoimmune disease as well. And they can also mimic the rheumatology diseases as well. Heavy metal toxicities, environmental toxins, air pollution, glyphosate, pesticides, mold, all these different factors can trigger autoimmune disease. And also we know that vaccines can also be a trigger as well. On top of drugs, also we know you can get drug-induced vasculitis, drug-induced lupus as well. So those are all the different little factors that can trigger and even cause flares in autoimmune diseases.
Yeah, it's a complicated pathway, and I think it's important for people to understand. If you've been dealing with an autoimmune disease, and again, you're working with a rheumatologist, again, you probably have had very little testing outside of the standard tests that are really just looking at inflammatory markers. And they're not necessarily looking at other possibilities of why you might be experiencing what you're experiencing. So I think it's good for listeners to understand that, if this is something you've been dealing with and your rheumatologist isn't doing that detective work, you probably want to get in the hands of someone like Dr. Yu or a functional medicine practitioner who can help guide you on what test might give you the best information to understand these root causes. Because if you understand what the cause is, it's treatable. And I mean, treatable at a root cause level, not treatable necessarily the way it would normally be handled with just, like I said, steroids and biological medicines. Like you said, they have their place. But if we really want to get people over the hump, we've got to dig a little bit deeper and do some of that testing.
Exactly. And sometimes medications are needed. I'm not saying that just because you get to the root cause that you can avoid medications completely. Sometimes you can, but sometimes you have to use a combination of um, herbs, supplements, other alternative therapies along with the medications just to get better.
Yeah. And you talked a little bit about diet. Can you tell us a little bit more? Because again, I think this is a really critical part of autoimmune disease. And are there specific dietary recommendations that you specifically recommend for people who've been living with autoimmune disease?
Yeah, great question. So this is a question I get a lot in my clinic and on social media. So there's no one size fits all with diet. I have arthritis and autoimmune disease. I got better with a plant-based diet, but I know people that don't get it better with a plant-based diet. And I think it all comes down to genetics and your gut microbiome. And there are patients that do get better with a vegan diet, but there are all patients that get better with a Mediterranean diet, paleo diet, and also keto diets as well. And what are the main factors that are common amongst all these different diets is ultra processed foods that gets removed out of all these diets. So your chips, your cookies, your food coloring, your processed meats, your fried foods, seed oils, all these are highly not recommended on all these diets. Okay. Other things that can cause issues are high salt. We know there's a pathway with very high salt diets that can cause inflammatory signals that gets triggered in the body, driving autoimmune diseases and inflammation. We have medications that block these inflammatory signals in rheumatology, whereas these salts, when you eat a lot of salt, it will trigger these signals to go up. So they're going against the rheumatology medications. Other things are potentially gluten. The question is it really gluten that's driving the inflammation, or is it the glyphosate and the pesticides? That we don't have an answer to right now. I think gluten gets demonized too much. I know autoimmune patients that don't flare on gluten. I myself, I don't flare on gluten. And people that go to Europe, they don't flare on gluten sometimes, but when they come back to the US and they start eating their starches, they start flaring on the gluten. So that's another root cause in a diet. And refined sugar is a big piece. Your ice creams, your sodas, your candies, your cakes, these have all refined sugar in them. And refined sugar is the number one biggest inflammatory trigger in not just autoimmune diseases, but in just humans in general. We're not supposed to have all these big sugar spikes when we eat food. So those are some of the things that are very common amongst all the different dietary patterns. But then you get to the little details with nightshades, potatoes, peppers, and tomatoes. They say tomatoes, peppers, and potatoes. Those are the main nightshades. Nightshades are vegetables and foods that contain something called selenine, which is used to help fight off these different insects from the plants. And that can sometimes trigger patients who have flares with their autoimmune disease. And those nightshades are removed in paleo diets, but they're included in plant-based diets and Mediterranean diets. Other things are lectins. Lectins can also potentially trigger inflammation. Even though the science is weak on lectins and nightshades, I've seen it in my own patients. And nightshades, lectins include beans and nuts, okay, amongst other food groups as well. That can also trigger some inflammatory signals in the body as well. And besides nightshades and lectins, there are grains as well. Even non-gluten containing grains can sometimes trigger flares in my patients. I do have patients who flare on rice. I have patients that flare on quinoa. I have also patients that flare on protein powder as well. So that's surprising for a lot of people. Protein powder is supposed to be healthy, but because the gut microbiome is so dysbiosis and out of balance and leaky, that patients will flare on healthy foods. So those are the type of potential triggers of inflammatory foods in the body.
Yeah, and in our practice, we actually test people specifically to find out if you got specific food sensitivities. We don't really use the term food allergy. It's not really the right term. Food allergy really describes the anaphylactic, severe, serious, allergic reaction. If you eat a peanut and your face swells and you can't breathe, you're allergic to peanuts. But like I said, if you eat a tomato or a white potato and 2 days later you get joint pain or headaches or a gastrointestinal problem, some of these food sensitivity reactions could be delayed perhaps up to 3 days after the fact. So even if you kept a very detailed diet diary, it could be difficult, if not impossible, to pinpoint which foods actually trigger you. But
Mhm.
I agree. I think, the science, I guess, behind all these different diets that seem to help, again, is that they remove all these ultra processed, refined junk foods out of the diet. And you talk about lectins, and I got to be honest, I'm not sure I'm in the lectin camp at all. I've looked at Stephen Gundry's work, and like I said, the science behind it's weak. And I think the problem I have is when you look at cultures around the world that eat a high lectin diet as their staples, it seems that autoimmune disease in these populations is actually very low.
Mhm.
So I think just looking from a population standpoint, I don't know. I'm not convinced yet that lectins are the evil that they get touted to be.
Right. I agree with you that from a population standpoint, like the blue zones, they eat a lot of beans and nuts,
Right.
very healthy and live the longest in the world. But I think from an individual standpoint, when it's patient to patient, there are patients who, even though the science is weak, I have seen patients who flare on beans. I've seen patients that flare on nuts. And could it be something else besides lectins that we haven't discovered yet in science? Possibly. But I think because their gut is so dysbiosis and so out of balance, even though these foods are healthy, like lectins, they get triggered. But it's not every single patient. I mean, I myself, I eat beans and nuts. I don't flare, but I do have patients who do flare on them, and they just have to work around it.
Yeah, and I think we should always qualify when we're talking about foods and food reactivity. We have to qualify American food because, like I said, I've had people who travel outside the U.S. They eat foods there that they know bother them here in the U.S. and they tolerate them perfectly fine. Again, they can eat the gluten in Italy, have the dairy in France, have the lectins outside, and they seem to be fine. So, is it something else we're doing to our food supply that sensitizes us in some way to that food? I think that's very possible, if not probable.
Mhm.
And so, again, it's a bit complicated because of the nature of how food is essentially grown, harvested, treated, that it's a little bit different than, the standards of food supply in the US are very different than the EU and other parts of the world. And, despite whatever your political stance might be on anything, I think the one thing that most of us in the healthcare field are happy to see is that, RFK Jr. and HHS are really pushing food companies to get rid of junks, get rid of dyes, get rid of artificial colorings and flavorings. So I think as a whole, that only helps us as a population.
Exactly, I completely agree. I mean, what RFK has done with the food movement is really good. I mean, from a population standpoint, even though there's a lot of people that disagree with it, with his policies, I think overall removing these artificial colors in there and other things he's gonna do in the future, removing all the processed junk is only gonna help us from a health standpoint.
Well, you look at a lot of the artificial dye where we know some of these are not just, you know, potentially bad, particularly for children, but some of them are just downright toxic. And the fact that they're actually banned in the EU and banned in other parts of the world because of their known toxicity, why on earth would they be allowed in the American food supply? And
Exactly.
again, that's a different conversation. But again, I think it's all a positive shift that we're seeing is that food, some of the big food companies, I just saw yesterday, Heinz, Kraft stepped up and they announced that they're going to be getting rid of a lot of, junk from their foods. Other food companies have stepped up and saying they're going to start getting rid of artificial colors and dyes. And so again, I'm hopeful that in time, this will translate to less chronic illness in the American population, including autoimmune disease.
Yes, I hope so too. Yeah, it's it's a new movement, so hopefully we'll see the percent of autoimmune cases go down. But it is a lot in the world. It's like around 10% of the population does have an autoimmune disease now.
So, for people living with, various autoimmune diseases, when is the time as an integrated rheumatologist, are you like, hey, we can do diet, we can do lifestyle, but hey, this is where you probably need some kind of medication. Is there a threshold for you where that might be your recommendation?
Yeah, when I see patients so swollen in my clinic, let's take arthritis for example, rheumatoid arthritis. If a patient comes with rheumatoid arthritis in my clinic and their numbers are very high and their hands are completely swollen, they're limping in my clinic, I'm like, hey, we can do alternative therapies and diet, but I have a very short leash. You should probably start some medication today. Um, or if they have lupus and their numbers are off the charts, I'm like, you know, you're on the verge of going to the ICU or the hospital. We should start something today and start potentially even steroids and then start the diet at the same time. And eventually I can wean you off these drugs. It's not like we're going to keep you on them forever, but we do want to minimize the risk of you having chronic changes on your x-rays, on your organs. That's what we don't want.
Yeah. Well, again, as someone living with MS, I kind of feel the same way. With my patients, again, when I see people declining, when they are getting worse, we're not slowing the train down despite all these other things we're trying to do through diet, lifestyle, nutritional supplements. Sometimes it's not enough in the moment, and we need to prevent having more serious, damage to the tissue. In the case of MS, it's the brain. In the case of rheumatoid arthritis, it's the joints. So I think it's important for people listening to understand that there's no shame of going on medication if you need it in that time. But just because you've gotten on a medication doesn't mean you can't come off it at some point. It's not a lifetime commitment that once you're on, you can't ever get off. I mean, I took an MS medication, briefly, and I have not done it since, but I at the time it seemed like the right choice for me, and it's okay. Again, you're not necessarily committing to it for the length of your life.
Exactly. There's a time and place for everything. I know most doctors, they don't have a plan in place to take patients off of medications. But when you go through an integrative doctor like myself or you're a naturopath, there is a strategy to help you to get off these drugs. Drugs aren't evil, but there's a place and time for them. And not everyone needs these medications because you can heal yourself naturally.
Yeah, again, I know every autoimmune disease is a little bit different, but as a whole, are there specific, nutrients or herbs that you kind of recommend for a lot of your patients or something people might consider to help improve their health?
Right. I mean, inflammation is the root, like, of all autoimmune diseases, inflammation. So I really like omega-3 fatty acids or pro-resolving mediators. I think that's excellent for fighting inflammation. Turmeric is also very good as well. Boswellia is really good with fighting inflammation. Vitamin D I really like as well. Vitamin D is very underrated. Vitamin D is in all immune cells as a receptor. So a lot of people, they're very low on vitamin D and their doctor never even checks them for it, even though it's so vital to the immune system. It can cause a leaky gut when you have low vitamin D levels. So, I mean, that's my core. And then, of course, we have the antioxidants, glutathione, NAC. I think those are very important as well to fighting inflammation and helping the mitochondria in general. When you have autoimmune disease and inflammation, your mitochondria is damaged. That's why you see so much fatigue and brain fog in patients. So, working on the mitochondria, well, of course, you can use supplements like acetyl-L-carnitine, um, coenzyme Q10. Some of these supplements, along with glutathione, can help with the mitochondria. So that's just a foundation in general for, I would say, autoimmune disease in general, not a specific diagnosis.
Yeah, and I'll add in Artemisia is actually one of my favorite herbs for autoimmune disease. And, we use Artemisia, and of course, there's different species of Artemisia. They've used Artemisia around the world as a treatment for malaria, but Artemisia annua what they call sweet wormwood, actually has been studied in rheumatoid arthritis as an immune modulator. So,
Mm.
the beauty of these plants is that they do so many different things. We got some plants, like you said, curcumin or turmeric, that can be anti-inflammatory, or boswellia. But this ability to modulate the immune system and potentially downregulate some of this autoimmune response can be tremendously helpful. And again, I find it's very safe, very well tolerated. I will distinguish that there is a product called artemisinin, which is a specific part of artemisia, and there have been at least some case reports of liver toxicity with pure artemisinin. We do not get that when you use whole plant artemisia. And in clinical practice, I've never seen anyone have a liver problem using whole plant artemisia. But that's just another really effective plant I've seen, particularly for rheumatoid arthritis.
Yeah, and also some of the herbs that we use for Lyme, I mean that you use probably a lot is like cat's claw and
Yeah.
some of these other herbs. I mean there are immunomodulating properties to them that not just it's not like a band-aid because you can use ibuprofen and some of these other pain relief medications that can help with inflammation, but really it doesn't modulate the immune system that well. Some of these herbs they can modulate the immune system and bring down the inflammatory signals that some of these rheumatology medications also do as well. So there is an overlap between these herbs and naturopathic medicine with the rheumatology medications with the same mechanism.
And are you using any low dose naltrexone in your practice?
I am definitely using low dose naltrexone. One of my favorite compounded medications for not just rheumatology patients, but just in patients in general with inflammation, brain fog, fatigue. It's really hit or miss though. Some patients do not respond well to them. Some people do. Um,
For people who might not be familiar, can you explain a little bit about what low dose naltrexone is?
Yeah, so naltrexone, which is not low dose, naltrexone itself is at 50 milligrams, and it's used as a medication by regular doctors, like your primary care doctor, for example. And it's used to help with patients that are trying to get off of painkillers like opioids, such as Vicodin, Norco, some of these medications, they're morphine that they're addicted to. And the doctor wants to get the patient off of it, but when you get off, there's withdrawal side effects. So naltrexone at 50 milligrams is to help minimize this withdrawal side effects. Now, low dose naltrexone is much lower. It's anywhere from 1% to 10% of the dose. And what we have found in research is that it's actually anti-inflammatory. It actually works on some part of the immune system called toll-like receptor 4 specifically. And when you work on that, it actually can calm down the immune system and it has been shown to work for various problems and different autoimmune diseases. I think there's some research in multiple sclerosis, lupus, rheumatoid arthritis. There's been case reports on dermatomyositis as well. So there are pockets of research out there on what potentially low dose naltrexone can help with. So theoretically, from a mechanistic level, it's great, but does it really translate to a clinical level when you see the patient? That I would say it's more hit or miss. Some patients they do really well in my clinic. I put them on it. It's the best thing that they ever went on. Other patients they hate it because they said, "Oh, I got more joint pain," or "Doctor Yu, I have more side effects. I have nightmares now." So the known side effects of low dose naltrexone are nightmares, vivid dreams, anxiety, and insomnia. Those are the some of the more common ones. Um, but I would say most of my patients tolerate it very well.
Yeah, I've had generally a very positive experience with low dose naltrexone. And part of the mechanism too is it binds to opioid receptors in the brain for just a
Correct.
few hours. And then when it comes off, it gets your body to release your own natural opioids, which are your own natural painkiller. So as a pain management tool, which is usually part of the problem for most people with autoimmune disease, this again is just another way to help modulate pain in a much safer way than using something like a narcotic or even, ibuprofen. But you're right. I find it's about a 50-50. 50% of people seem to do really well with it. 50% of people kind of doesn't do anything. Fortunately, I've had very few complaints. Again, people get the weird, wonky dreams. And in that case, I found, because usually we recommend people take it at bedtime. If people take it in the morning, sometimes it helps offset that stuff they get at night, and then they do just fine. You don't have to take it at bedtime. It's not a medication that makes you drowsy or sleepy. So I've had people take it in the morning versus the evening, and sometimes that help. And then yeah, I get a handful of people that just don't tolerate it for whatever reason. But what I like about it is that it's got a great safety profile. They've done studies in children and adults. It's very cost effective. Our
Mhm.
pharmacy here in California, I think a 3 month supply is about $45, so it's very cheap. And
Mhm.
my feeling for anyone dealing with autoimmune disease, it's worth a try if you've never tried it.
Exactly. It's such a low risk medication, and also I forgot to mention it is studied in fibromyalgia. So there are some rheumatologists out there that do prescribe low dose naltrexone. The savvy ones do. So I love it for fibromyalgia.
Yeah, are there other things outside of medication supplements that people should think about doing? Maybe something in their exercise or movement regimen, other types of therapies like maybe red light therapy, hyperbaric oxygen therapy that might be beneficial.
Yeah, so as far as exercise, I just tell patients exercise up to your tolerance, but they should move. Tai Chi, Qigong, yoga, anything that's a movement is good for you. Okay, you got to keep moving, you got to help with the mitochondria. But also, as other alternative therapies, hyperbaric oxygen therapy is great. It's low risk, but you got to do a lot of times. That's the only problem with it. You got to do 20 times, maybe 30 times. And it can help with inflammation, wound healing as well. I mean, we use it in the hospitals for wound healing. Other things are red light therapy can be very helpful. You don't have to go to a sauna. You can buy one that's small. You can use it in your room. So red light therapy is also very good. Other therapies are vagal nerve stimulators are very good for autoimmune disease and inflammation. So you can stimulate your vagus nerve. Well, before I talk about a vagus nerve stimulator, let's talk about what a vagus nerve is. Vagus nerve is cranial nerve 10, and it comes from your brain all the way down to your gut through the neck. And that controls your parasympathetic nervous system. When you stimulate it, you actually calm your body down, and you can stimulate the parasympathetic nervous system. That's your rest and digest part of your nervous system. And when you do that, it's actually anti-inflammatory. So before the invention of these non-invasive vagal nerve stimulators, where you can just attach it to your wrist or your ear, we were doing surgical vagus nerve stimulators, where a neurosurgeon would be putting it in patients' bodies for depression, anxiety, epilepsy as well, that were resistant to medications. But now there's so many brands out there that you can actually just use. You can cook, you can read a book and use these at the same time. And there are studies in rheumatology with RA, with lupus, fibromyalgia, ankylosing spondylitis. These studies are coming out to show that it actually helps with pain and inflammation and their autoimmune symptoms.
Yeah, I love the vagus nerve stimulators. I actually bought one myself at a conference, I think last year, called Truvaga. And I like a lot. You can just kind of hold up your vagus nerves kind of right here on the side of your neck, and you just got a couple little metal leads, and it's plug and play. You hit go, it just runs for a couple of minutes, but you can feel it like instantly when you're right on the nerve. And often people feel just kind of calm, relaxed feeling. So again, for I think not a terrible amount of money, it's a pretty decent investment just as another way to try and get your nervous system to chill out a little bit.
Exactly. Yeah, there's so many tools out there to help patients overall, especially in the integrative space.
Well, before we close out today, I want to give you the last word. For someone who's brand new to this, where do they start?
Yeah, I mean, start with diet first. I think you gotta examine your diet and examine your surrounding. Look at your environmental toxins. I know we don't have time to go into that today, but look at your surrounding. Are you exposed to any toxins? Are you using a lot of plastic? Are you overly stressed? Is your workplace toxic? Do you have toxic family and friends that you need to remove from your community? Because that can drive your autoimmune disease. Okay, that's number one. Number two is find a rheumatologist if you think you have a rheumatic problem. Find Dr. Ingels here, who is well versed in autoimmune diseases. He can help you too. You don't have to always go on medications. You can also go to a doctor like myself who does use principles of functional integrative medicine. So I usually call myself an overlap between what naturopaths do and what rheumatologists do. So I'm a blend of a little bit of both. Um, Doctors like me are very rare out there, so you're gonna have to maybe I'm one of the few ones out there. So you can find me on the internet. I'm at myautoimmunemd.com is my personal website, but you can go find me on my clinic website, which is drlifestyle.org. That's drlifestyle.org. And my handle on social media on YouTube and other places like Instagram is my autoimmune MD.
Well, we will make sure and post all these links for those tuning in, and certainly if you're in California, but I know you're licensed in several other states, so I know you can
Yeah.
work with people outside of California as well.
I'm licensed in 15 states. So I've seen patients internationally just for a second opinion. So if you're not in the state that I'm licensed in, you can always fly to see me one time a year. So just go on my website, you can get all that information on there.
Yeah, and I know that you've also developed a course for autoimmune disease. Is that available yet?
That is available. You can go to my website, myautoimmunemd.com. That's MY. Those are my initials, myautoimmunemd.com. And then you can find the autoimmune course. It's called the 21-day reset program, where patients, I walk you through going through an anti-inflammatory diet, which I have found successful in patients. Sometimes patients get better within 2 weeks, even 1 week on it. And I walk you through environmental toxins, talk about stress. So we go through every facet of things that you should look at with autoimmune disease and how to implement it into your own life.
Great. Well, I said we'll make sure we get all the appropriate links posted so that people can check that out. Again, it's a pleasure having you on the show. It's always great to talk with you. I know you got so much great information for people dealing with autoimmune disease, and I just appreciate you spending time with us today.
Thank you so much, Dr. Ingles. I really appreciate it.